So I don't think there's ever been a time in modern medical history where the time of an individual HCP is a bit more of a premium than it is right now. The ability to quickly gather, sort, and identify trends, updates, topics, key opinion leader networks to reach out for collaboration is so hyper important. It isn't just about what is being pushed forward through a publisher or from a pharmaceutical company via a publisher. It really is about that networking, seeing where the best research is going, paying attention to research trends that are preclinical, being able to see the entire kind of spectrum of the future trending of a therapeutic area. That's really the job of the HCP, and they have no time to do it.
So healthcare professionals today have a very busy daily life and they need to be updated on their field, but at the same time there is a lot of content published every day, so they really need to find what is the proper content among all the information that is out there, which is relevant for them with the proper quality, which will help them to improve on their own practice.
People in general have short attention spans, shorter and shorter these days. And physicians are overburdened. They really want to do a great job, but they face increasing pressure with less time with their patients and increasing administrative responsibilities. There was a recent study in the United States, for example, where it showed that physicians, many of them, have maybe 3 or 4 intervals during the day, maybe 10 minutes each, and that's all they have for education. So that means that we have to provide bite-sized learning with links to more information so that they can dig deeper if they want to at that time when they're watching, or they can find it for later when they have more time to look at the details.
Elsevier definitely has the ability to meet the needs, the current needs and the evolving needs of healthcare professionals. We listen to them frequently. We understand the types of format that they want their content delivered in, whether that be print or online, and we'll actually evolve to meet those needs as they change over the course of time.
There's been a strong shift towards digital communications and consumption of medical communications over digital channels over the past decade, and I think that shift has accelerated over the past few months. HCPs are consumers just like anybody else, and they've come to expect getting the information they want, the way they want it, when they want it, in the fashion they want it, and it's important that in scientific communications that we're providing that content to them.
In the same way that HCPs find digital content to be the most effective way to consume information, digital content has also become the most effective way for brands to share information. And so the content universe has grown and evolved and continues to amass at such a rapid rate that the possibilities and the opportunities to share digital content have become truly endless. Brands have essentially evolved from being strictly an outbound effort to becoming an inbound engine that allows brands to reach audiences that are more qualified than they have been in the past, because they are able to target audiences based on their preferences in the way that they want to receive information and consume that information.
When I first began in medical publishing, it was really about approaching PAs, nurse practitioners, physicians through print and 8-page journal ads, printed CME, large medical conferences, and now we digest everything digitally. Those same customers are looking at their devices over coffee every morning and deciding what they're going to read and digest, or perhaps even subscribing to certain channels or digital properties that screen content for them, and really being able to attend meetings, especially virtually, listening to podcasts, and so that digestion of information has completely morphed into very digital content that's at our fingertips every day.